Hi, my name is Lisa Swartz and welcome to my presentation on the teaching strategy of simulation. I've provided an image of myself here so that you can actually put a face to the name as I'm speaking. I'm the one in the middle. And when we ask ourselves, what is simulation? Simulation is really something that resembles reality. And how you can use that as a strategy in teaching is that it prepares learners for complexities of professional practice. Simulators set the stage for students to work in as real an environment as possible, to collect data, make clinical decisions, and reflect on their practice. Students become active learners. Simulation is defined as a representation of the behavior or characteristics of one system through the use of another system. Use of simulation in healthcare is a technique rather than a technology. And that's something that's really important to consider. Simulation was first developed in World War I with aviation to train pilots before they actually were flying the planes, and it's been used in healthcare since the 1960s with the resusci-andol. So if you've ever had the opportunity to take a first aid course, then you've actually been using a simulator as part of a teaching strategy when you've put breath sounds into the doll. Today there's more sophisticated simulators, and that's what my presentation is going to focus on, simulation in healthcare and what the advanced simulators can do for us now as a teaching strategy. This is Noella. She is a birthing simulator, and you can see she's given birth to a baby in the background who is also a simulator. The students can actually look after her before the baby, during the delivery process, and afterwards. They can listen to blood pressure and heart and lung sounds. She can be programmed to respond to the students as the instructors can operate her in the control room. Up in the corner here, this is a simulated baby. He is about $60,000 and he can be programmed to do heart and lung sounds and cry. And so lots of fascinating stuff that can provide really good, as close as possible, clinical situations for our students. So that leads me to talk about the advantages of simulation. And you can see in this picture here, this is a simulated arm that we can fill with artificial blood, and students can get flashback, and it has increased their skill performance and IV starts in clinical practice. So it really builds learner confidence and allows them to be in an environment where if they make a mistake, they can revisit that mistake and run the scenario through again. Provides faculty with the opportunity to give formative feedback throughout the process so that students feel well supported. It also allows faculty to program simulators to do situations that students may not actually have the opportunity to do in clinical practice, such as really more complex scenarios. Because when you're in clinical practice with real patients, you sort of have to take what you get when it comes to case studies and diagnoses. Also, the instructor is less prone to jump in because it's not on a real live patient. They can watch and allow the student to identify and correct their own errors, whereas in clinical practice, they'd be more prone to jump in if they see something not going so well. Some limitations of simulation are that it is extremely expensive, can run up to $1 million just to have 3 simulation rooms running. The equipment, as I said, dolls are about $60,000 depending. I think the lowest one is about $12,000 on the low end of the simulation. So very expensive. Also, to get faculty buy-in can be challenging. Instructors are very leery to look at something that they aren't used to and to think about integrating that into the curriculum. So also maintaining the equipment, again, cost is challenging. I've included in this presentation a simulation scenario that you can watch through YouTube or click on here. I won't play it right now just for time purposes, but it actually shows some students working through simulation on a simulator where the simulator responds and so on. And for best practices in simulation, we really want to think about the whole process of simulation, which leads us to the nursing process, where students really assess before they're going into the simulation. They analyze what's going to happen, they plan for that, they implement what they're going to do in the simulation, and last but not least is they evaluate how the simulation went. And you can see in this picture here, simulation room setup, there is a big screen TV where students can actually watch and act as a lifeline to the students that are working through the simulation. And also the simulation is recorded for debriefing and feedback afterwards, which leads us into the role of the educator. So I've provided a video here on an educator debriefing students following the simulation. The role of the educator is really a facilitator in the process. They provide ongoing support to the students, they provide encouragement, they really ask key questions such as, what went well for you? What could you do better next time? And the simulation only takes about 5 or 6 minutes, whereas the debrief will take longer in that process to tie in all the learning that has taken place. And this video is quite short and it links to the last video, which was the scenario, and this is the debrief piece of it. When we think about implications of the simulation, we really want to consider ethical questions such as we want to make sure that we are not replacing the care at the bedside and the human interaction. So we want to still promote that with our students, and this does not replace, I can't emphasize this enough, clinical practice experience. It's an enhancement to that clinical practice experience so that students feel more prepared and more confident in the clinical setting. Also, there's the ethical question of making sure that we have consent signed for our students because there is a videotape component. Culturally, we can have different simulations that simulate different ethnic backgrounds such as Asian, Caucasian, African American. So there is First Nations dolls that we can use as simulators. Also, our dolls can be switched out to be gender specific. We can make them male or female, whether we want to switch out the parts on the doll to accommodate that. I've provided some references here if you're interested in some more information about how to integrate simulation into your teaching practice. This is nursing focused, but you can also think about how it would go into your practice as teaching no matter what subject you're teaching, and how simulation can fit for you, whether it's a computer simulator, and what would make your students more confident and motivated and excited to learn about the topic. So thank you. I hope you've enjoyed the presentation.